But welcome, everyone. We are glad to have you here. Really excited for today's rounds. And we're going to get started very soon. Come on in and get comfortable. We have colleagues from Camden Coalition joining us today, and we are looking forward to our discussion. And we'll get started in a couple of moments. So welcome in. If you signed in with a preset link, and if you can, please change your name to be you so that we know who's in the room with us. And I'll be silent for a moment and then we will get started. All right, we will go ahead and get started. So welcome everyone. These are our social medicine rounds. We are really glad to be together in community virtually to have this discussion. Our social medicine rounds, just as a reminder, from the Department of Family and Social Medicine, are for all three tracks to be able to come together to think about issues that are affecting the Bronx community. Oftentimes, these issues actually have national ramifications as well. And so we've covered some of the topics that you see included here. And if you've missed some of these rounds and are interested in what we've discussed and would like to kind of track back to see, you can go ahead and see the DFSM website at this QR code and get some of the old rounds. These rounds are recorded for folks who are not able to attend because of clinical duties to be able to see what we discuss. So we're going to continue on and welcome in our speakers for today. And for that, I'll turn it over to Dr. Tattleman. I think you're on mute, Ellen. The age-old curse. Oh, there you go.
Good afternoon, everyone. I'm sorry for that. I'm really excited for this round. Really want to hear what our speakers have to say. I'm going to introduce them. First, I'll start with Victor Murray, who is the Senior Director of the Community Engagement and Capacity Building at Camden Coalition for Healthcare Providers. He oversees the management and implementation of the Camden Coalition's community outreach and engagement strategy, and the primary mission is to provide meaningful opportunities for consumers. Through various regional and national programs, including the Coalition's Community Advisory Council, the National Consumer Scholar Program, and Amplify, which is a National Consumer Voices Bureau, and other ambassador initiatives, his focus is on amplifying community voice in program and system transformation. In addition, Victor is the executive lead for the organization's diversity, equity, and inclusion efforts. So welcome, Victor Murray. And our second speaker is Rebecca Esparza. She's an MBA, and she's a two-time cancer survivor, both ovarian and thyroid cancer. She's traveled all over the world to represent cancer survivors at various cancer advocacy activities, speaking engagements, committees, and forums. She's a long-term survivor of ovarian cancer, 20 years, and she's motivated to speak up for the underserved and marginalized, especially those without access to healthcare and/or health insurance. As a cancer patient who's experienced a cancer diagnosis with no health insurance, she has assisted countless patients and caregivers to access services and programs to assist in their personal journeys. Her passion is making life better for children, whether it's lovingly spoiling her two nephews or helping dreams come true for critically ill children through her volunteer work with Make-A-Wish Foundation. So welcome, Rebecca and Victor. Really happy to be here to hear what you have to say.
Thank you so much, Dr. Tattleman. So we are going to turn it over to Victor and to Rebecca, and they'll just kind of work off of shared slides. So I'm going to go ahead and stop sharing my screen. And Vic, if you want to upload your slides, we will get started. Again, to kind of review what we'll be talking about, Camden Coalition is a really interesting model that many of us have read about in popular media, popularized by a couple of different sources, as Camden Health, and their work really goes beyond just what they've done within their health center to a larger national movement. And so we're going to be hearing about some of the community engagement work and what that looks like. And I'm going to turn it over to Vic for that.
Thank you. Thank you for that warm introduction, and just a privilege and honor to meet with you all this afternoon. And so I guess what was not mentioned in my introduction is I've been with the organization for going on 15 years now. And so one of my greatest gifts is I can speak to just enough about most things that have happened in our organization, historically, and even, are thinking about, moving forward. And so at any point you have questions or thoughts, this is kind of a formal, right, discussion. However, feel free to raise your hand, feel free to throw questions in the chat, and we'll try to address those as they come up. And so I have with me colleague, friend, partner, Rebecca, and so we'll be tag teaming our presentation for this afternoon. And so really today we're going to talk about Camden Coalition, right, overview, background, and then more specifically, how we have thought about community engagement.
And Vic, I'm so sorry. I don't know if you wanted to upload your slides. We're not seeing them on the screen just yet.
Yeah, I just like to talk a little bit.
Okay, I figured.
Yeah, so when I share my slides, I won't be able to see people. And so, I like to see people for as long as I can.
Oh, I love that.
For sharing slides, yeah. So just, but thank you for that. Yeah, so we'll share slides in a second. But just in terms of, context, background about the organization, we're a nonprofit based in Camden, New Jersey. And really all of our work is geared towards supporting individuals with complex health and social needs. Persons who have traditionally fallen through the cracks of the various systems that oftentimes we represent, right, in the work that we do. And oftentimes that work has caused harm to communities, has caused pain to communities. And so how do we reorient, right? How do we transform our systems of care, both on the health side, on the social side, to honestly just do right by people, right? Supporting them through the various ebbs and flows of life in their own personal journey. And so that's really what's at the core of our discussion for this afternoon, right? Really, how do we focus on individuals, right? That most important piece of data, and wrap services and programming around persons in order to be able to support them better in meeting their goals. And so we partner, right, with a host of organizations and institutions in order to achieve our mission and vision as an organization. We partner with healthcare providers, community members, consumers, right, community-based organizations, health systems, governments, payers, and many, many more groups in order to, again, rethink how we're providing services for individuals who have oftentimes not had their needs met. And so that's what's really at the basis of our organization. And today's conversation will focus more specifically on our community engagement activities and how we've oriented our organization around such. And so just for organizational framing, our kind of strategic plan and how we think about the work really revolves around 5 focus areas: demonstrating what works, expanding the evidence, being an expert, and then we'll talk more about those will features in the middle of that picture there. And so when we think about demonstrating what works, really that's providing the field with concrete guidance on what works with what groups of individuals and in what context, right? So oftentimes, programs are stood up, right? Programs are scaled. And how do we know that the programs that we're standing up, programs that we're scaling actually are working, right? They're having the desired impact that we're looking to have, right, as we're working with communities. And so, again, demonstrating what works, right? And that happens through a lot of our community-facing programs. We have community health workers, social workers, nurses, lawyers, a whole host of individuals working with individuals every day in a community around their goals. Our next will turns into expanding the evidence, right? And so really building on our data expertise and quality improvement strategies to inform, again, payers, providers, our community, on really understanding, what are the unique differences, right, in the communities that we're working with, and how do we measure outcomes, right, in a way that's pragmatic and also uses multi-site research. And so many of you probably have heard of the randomized control trial, right, that we ran some years ago, and then more recent articles and research that's come out regarding our organization's work, and I'm happy to talk more about that if folks desire to. And that leads us to our being an expert, right? And so, we're working in the community with individuals every day. We're working with partners, organizations, right, building this evidence. And now, how do we disseminate, right? How do we share those learnings with the broader field, right? And so a lot of that happens through our training, right? Consulting, teaching work, and curriculum and publishing that happens regularly. And again, that's a part of our effort to really build, right, our community, our healthcare community, to be able to be better equipped to work with individuals who suffer from various complex health and social needs. And all of this happens right across the organization within respective departments. And thus the work is interrelated. And we're really trying to enhance the organizational alignment, right, among our work. And all of this is rooted in advancing equity, right? And so that person, that individual is at the center. And so, and speaking about that person, right, or that individual, that brings us to community engagement, right? And really, what is community engagement? It's become such a, I guess, a loaded term as of recently, right? More and more individuals, organizations are energized, right? How do we talk to community, right? How do we engage community, right? How do we understand the issues, the challenges, right? What's working, what's not working, right? And so there's so much conversation around community engagement, to the extent that it's oftentimes necessary to start with, how do you define community, right? How do you define community engagement? And so when we think about community in general, it can be defined, right, in a number of different ways. It can be defined by a group of individuals who share in a geographic region, right? A group of individuals who perhaps share similar characteristics, right, or experiences. Right? These are all different ways to define community. Maybe it's a group of individuals who experience a medical condition, right, or a healthcare diagnosis, right? All different ways to define community. But how are you defining community, right? An important definition, right, to really think about for yourself and for your organization, because that then impacts, right, the engagement strategy or the how, right, in the different ways that healthcare organizations and other institutions may engage persons with lived experience. And so, just to be clear, as we're talking about community engagement in this conversation, we're not talking about community-based organizations, right? We're not talking about partners, right? We're not talking about institutions. We're talking specifically about how do we engage persons with lived experience, persons who are oftentimes the end users, right, of the systems and resources that we support in our organizations. And so when we think about community engagement, there's a spectrum, right, from informing, consulting, involving, partnership, and being consumer-led, right? And so Rebecca is going to provide us just more detail and examples of what this spectrum looks like as this work can unfold.
Thank you, Victor. And once again, thank you so much for giving me the opportunity to share my lived experience with everyone here. And while I'm at it, I'll go ahead and say, I've been called everything from a patient advocate to cancer survivor, person with lived experience, consumer advocate. There are many different names, and everybody tosses different names back around. But at the end of the day, I'm somebody that's sharing the things that I've been through, hopefully for the betterment of those that are going to experience my same things in the future or have experienced the same things I've experienced in the past. My main goal in being an advocate and sharing my story and sharing my journey is that everything that I've suffered through ever since 2001, when I was diagnosed with ovarian cancer at the age of 30, everything that I've been through is not for nothing. All the pain and the suffering that I still experience today, I still have long-term side effects from the chemotherapy that I received in 2001. And I never had a chance to have children because of the life-saving, surgery that they gave me for the ovarian cancer. All that to say, it's not for nothing. And if I'm able to help at least one person through their experience, through what they're going through, by sharing what I went through, then it was not all for nothing. So part of what I could probably sit here and give a 45-minute presentation on each of these elements that I have done something with, but I am not going to do that today. I'm going to share just a couple of things that I've done. Informing consumers interact with us and may advocate for themselves and others. I've been to the Hill representing people in my hometown. I'm coming to you live from Corpus Christi, Texas. It's along the Gulf Coast, about 3 hours south of Houston. And I represent people in my area at the state level and at the national level on the Hill. And I've been to the Hill over, I would estimate at this time since 2000, excuse me, since 2003, I've been on the Hill at least 70 times. Because it not only has it been 20 years, but every year I go at least 2 or 3 times a year for different organizations. And that's just to make sure that cancer issues are at the forefront of our legislators' minds and let them know that people back home are still suffering. We're still seeing an alarming rate of people, especially in the county that I live in, Nueces County here in Texas, have a disproportionate amount of people that do not have health insurance to this very day. And that's very shocking and very alarming. But we're trying to do what we can. And that's why I lend my voice and I travel all the way to Washington, D.C. from Corpus Christi. And as you can imagine, it's quite far away and we're quite south, small town. It takes me 2 flights and almost a full day of traveling, but I will not be deterred. Another thing that I do is, consumers share their stories for the benefit of research and education. I'm a consumer reviewer for the congressionally directed medical research program. And basically what that is cancer research projects that are being considered by scientists. They've allowed consumer reviewers a seat at the table with the greatest scientific minds of the world that gather and convene and talk about where this research money from the government should go to. And they invite consumer reviewers and survivors and caregivers like myself have a voice in what medical research is going to be funded. So it is quite a humbling experience to listen to all these researchers from all over the world convene and talk about all the medical and all the scientific things that go into a research study or a potential research study. And then they turn to me and say, well, Rebecca, what do you think? And it's kind of like, well, I'm not a scientist, obviously, but from the survivor's perspective, or as somebody who has been through chemotherapy before, have you ever thought of X, Y, and Z? Or have you ever thought of this part of the study that has some very harsh side effects that will be with the survivor long term, things like that. So there's so many avenues. Like I said, we could sit here for the next 45 minutes talking about different ways to engage people with lived experience and people that have been through some medically jarring things in their lives, but hopefully have them come to the table to help enhance the work that is being done in other areas.
Great, thank you, Rebecca. And so, this is just to say that community engagement, right, can happen in different ways, right, and in different styles and formats, right? Sometimes when we think about community engagement, the default brain goes to, right, let's do a survey, right? Let's do a focus group, right? And nothing wrong, right, with those activities. However, there are also other diverse ways, right, that we can engage a community, right? Whether it's through partnership, right? Whether it's through thinking about is this actually a consumer-led, right, initiative or group, right? At what point are we bringing in persons with lived experience to consult on the design, right, of this program? Or is it after the program is implemented? Then we go right to ask questions. Well, what happened, right? Why didn't this work, right? Can you fill in the gaps, right? And so again, just thinking about how we can even diversify, right, our community engagement and approach, and nothing wrong with informing, right? Sometimes a quick survey, right, that works to fill a need. But as we are engaging community members, it's important to be thoughtful, right, about what stage of this spectrum that we're engaging. And so this is a principle framework that we like to refer to from the VCC Alliance, their group, primarily in a cancer space, but just do a lot of good community engagement. And this is a good, representation of what consumer engagement can look like in a diverse way. And so just to provide some very practical, concrete examples as to what this can look like in the life of an organization, we have a couple different groups that we bring together within our organization. And so we have our Community Advisory Council, our CAC, and this is one of our really just major local initiatives that we run at the coalition. We have program graduates of our care management work, as well as other community members who participate in our CAC. And our CAC is actually a committee of our board, right? And so we have 4 open community member seats on our board, and the chair and vice chair of our CAC holds 2 of those seats. And so they're a part of our exec team right there, right, integrated into our governance model as an organization. And just thinking about, our CAC, they've really just proved to be an invaluable resource over the years, providing us with timely feedback and just keeping us honest to our mission to support the community. And so they directly participate in a number of different initiatives and programming happening across the coalition, but they've been instrumental in the organization's growth, and even helping us just to sharpen our strategic vision, right? Sometimes, in nonprofits, there's, mission creep, right? And you can find yourself kind of, going into areas that you might not necessarily be best for or equipped for, right? And our CAC Community Advisory Council plays just a vital role in helping us to stay committed, right? And focused on the mission of the organization. From our CAC, we actually developed a number of different programming, including our community ambassador program. And so this program had actually came to bear throughout the COVID pandemic. And so our CAC members were at the forefront of helping to shape our COVID response efforts here, not just at the Camden Coalition, but actually across our region. Again, they served as an accountability buddy and really just served as thought partners as strategies continue to unfold, really evolving at a mile a minute. But our CAC and community ambassadors were right there in lockstep with us. And so from the value of that partnership, we started our ambassador program. And really the focus is empowering, right, individuals to play a central role in community outreach and education efforts. And just to give you a clear example of just the power of, inviting folks with lived experience into these conversations. At one point, our organization and others were involved in community canvassing, which meant, we would basically go door to door, what is the vaccine, right? What is the importance, and just having conversations. What are the myths? What's true? What's not true? Having conversations. at that point, here in Camden City, the vaccination rate was roughly around 60%. So 60% of individuals 18 and above have been vaccinated. And so we had what we called a micro summit meeting where we would bring community partners, health systems, FQHCs, our local health department of health, the state department of health, again, all community-based organizations, faith organizations. And so we were in these meetings, right, looking at the data, and some, you hear 60%, and it was like, right, how do we share this information with the community? What is going to be the blowback, the pushback, right? And so we were a little hesitant in that way. However, we shared that information with our community ambassadors, right, as they were doing that outreach. And so one day I was actually canvassing with one of our ambassadors, Michael, and he was, going door to door, and a woman came from the apartment, maybe 2 stories up, and she yelled out the window, what's happening? And so he told her, and he's explaining, COVID to her and just everything that's happening. And then he said, when have you known, 60% of adults in Camden to get behind anything, right? Like, our voter turnout rates are significantly lower, right? And all these other numbers he started to give, which were significantly lower than 60%. And so he looked at that number of 60% and embraced that, right, as a strength, something we should be proud of, something that we should stand behind. Whereas as a group of providers, right, systems, partners, we were like, right, a little angst in sharing that number. And so I heard Michael loud and clear and took that information back to our partnership meeting to say, hey, like, this is how our community is talking about it, right? How do we lend our ear, right, to the way that they're messaging, the way that they're communicating and standing behind the data. And so that would have never happened, if we weren't side by side with community members, right, in that work. And so that's the type of, conversations, dialogue that happen, and just help to make strategy more rich, right, and more robust as programs are being developed. And so I'll pass it to Rebecca to talk about a couple of our national facing programs.
Thank you, Victor. A program of the Camden Coalition is something called National Consumer Scholars, and that's actually how I became involved with the Camden Coalition. I'm an advocate with the National Coalition for Cancer Survivorship, and through them, I got connected with a project that I was working with the NCCN. Got connected with Camden Coalition and found out about the National Consumer Scholars Program. So basically, they gather a bunch of folks with lived experience, either as the person that has experienced whatever it is, or as a family caregiver. And they basically give us really amazing training to be consumer leaders, advisors, and advocates. And they invite the scholars to come together at the annual Putting Care at the Center conference that the Camden Coalition puts together. And we work with the coalition staff on a variety of different projects, and it gives us the training and tools that we need to bring those lessons back and make change in our local communities. Another program of the Camden Coalition is called Amplify, and I'm also a part of this one. We lend our consumer voices. It's kind of like a speakers bureau for people with lived experience, where what we've been through can help different organizations with speaking engagements. And Amplify includes like a matchmaking type of thing where you could go to a specific website at the Camden Coalition website and look at who is currently part of the Amplify program. Like say you're looking for somebody who is experiencing or has experienced in their past homelessness, or if you're looking for somebody that has had cancer or other type of life-threatening illness, you could look at Amplify and see who has been trained through the Camden Coalition to share our experiences and help with those engagements and partnerships.
Yeah. And so that work is, thank you, Rebecca. It's just extremely important. You know, Rebecca mentioned that the training, right, and support for individuals with lived experience. You know, there's so much conversation. You know, how do we invite people to the table, right? Inviting them in to be a part of the discussions, but also, you know, it takes a lot to be at the table, right? Do I understand the conversation that's happening? The acronyms that fly by, right? The same three letters can mean 15 different things to 15 different people based on the sector that you're in, based on the organization that you're in, right? Based on the region of the country that you're in, right? And so a lot of our support involves, you know, sitting down, right, with our amplified members, looking at contracts, right, preparing material for their board meetings, right, for their speaker presentations, right? And so, yes, it's about inviting folks into the room, right, to diversify the table. And in addition, it's about supporting, right, individuals so that they could be the best version of themselves while at the table. And so one of our more recent initiatives is Inspire, right? And so speaking about that excitement and just that buy-in for community engagement nationally, while it's evident, while it's there, oftentimes people struggle with the how, right? And so, yes, I'm bought into the idea, but now what do I do, right? How do I go about that work? And so this Inspire initiative is comprised of four other community-based organizations, as well as folks with lived experience, including Rebecca, as you can see. And this group is building out a national strategy, right, to help health systems, health partners be able to really think about more deeply what does authentic community engagement looks like. And so that national strategy will include tools, resources rather, learning models and coaching models that organizations will be able to implement. And so look out for more information coming out about that soon, but definitely a gap, right, in the field as we think about where persons' interests are. And hopefully this tool being developed will be able to help individuals to be able to do their work more effectively. And so this is a slogan, right? You can't advance health equity without effective community engagement. Right? And so you can advance health equity without talking to individuals who are end users of our system, who are, you know, most impacted positively or negatively in some instances by the services that we implement. I also just want to say, and slightly digress, you know, oftentimes when we think about community engagement, we often fail to think about organizations within our institutions, right? Oftentimes, you know, there are people within our institutions that represent and live in the communities that we're trying to do outreach to, right? And not that they want to show up in that way to work. You know, maybe they do, maybe they don't. But I think it's just something important to think about, right? If we're thinking about community externally, right? How are we thinking about staff, right? Similarly, and the supports needed there to make sure that they too can do the work that they want to do, right? To make sure that they too are being paid, right, a decent wage, an honest wage, right, to do the work that they want to do. And so just, you know, a different orientation as we continue to think about how this community engagement conversation evolves. And so these are some of the values, right, that we've come to appreciate in our work. And Rebecca is going to talk a little to these.
Thanks, Victor. There are so many facets of why there's such a high value to incorporating community engagement. Not only do we get better outcomes, increase satisfaction and loyalty, build trust, and build more connections. I can't tell you how much it means to me to have a seat at the table with folks that consider me their colleague. And Victor already mentioned it. That just warms my heart, because 20 years ago when I started doing this, it was the complete opposite. 20 years ago, when I was going, or more than 20 years now, when I was going through cancer treatment, I felt like things were being done to me without any kind of questions about how I felt about the situation. And I didn't know anything. I was 30 years old. Now I'm 50 something. And I kind of look back on that and think 30, that was a baby. That was baby. I knew nothing about advocacy, being my own best advocate, um, telling the doctors what I felt about things, how I felt about things. When things weren't going my way, I didn't say anything. I just had things done to me. And when you're able to give somebody a little bit of power and empower a patient by inviting them to the table, amazing things can happen. It can not only help a patient or a person with lived experience, um, mentally and emotionally, but it can also lift them physically. So many amazing outcomes can happen by adding people that you're actually there around a table to help, when you actually invite them to join you in the conversation. You're advancing health equity, and we've also seen people with that were able to lower costs. So there's even a cost savings component that you could argue with. So and also 20 plus years ago, when I first started doing this work, it was unheard of to pay advocates or people with lived experience. And now we're seeing more and more folks at least have an honorarium, at least have some sort of a speaker's fee or something that allows us to be able to take time out of our workday to do things like this. So that way we can add to the body of knowledge, share our experience, but at the same time, like Victor was mentioning earlier, earn a living wage. So that makes a tremendous difference. So the things that community engagement is: asset-based, equitable, extremely impactful. And I know it goes both ways. I know I've sat around the table with some medical folks on a medical board that I've served on in the past. And they were talking, it was a conference for a bunch of physicians, gynecological oncologists. And one of the doctors said, well, I'd love to honor, some of my patients that I've passed. And somebody mentioned, not another clinician said, I think that's extremely morbid. And I had to pipe in and say, patient here, it's real life. It's real life. And I want to say my friends' names. I want to remember them. I know that, I'm not going to live forever, even though I've survived ovarian cancer for over 20 years. I want somebody to remember me. And these are the types of things that if a patient wasn't at the table, they might not have even bothered to do that little in memoriam type of little presentation at the medical conference. So it's extremely important, and to have patient or people with lived experience have a seat at the table when you're making these crucial decisions about these folks, because unless you've been there, it's really hard to put yourself in their place and understand where they might be coming from.
Thank you, Rebecca. And so when you think about, again, these characteristics, there are 9 listed here. We have tools and resources that kind of talk about these 9 characteristics more in detail, but it doesn't have to be difficult, right? Sometimes you just have to start with a conversation, right? A conversation aimed at wanting to understand, right? Wanting to hear, wanting to listen, right? Not about what I do, as a provider, right? But no, how do I listen, right? And really try to more deeply understand perhaps a different perspective, right, than I might have. And so when we think about, being asset-based, well, what does this mean? Well, really is also thinking about the values, assets, and strengths of the community, right? Sometimes we go in, well, what's wrong, right? What's difficult, what's not happening, right? But in addition, well, what worked well, right? What has helped, right? What are the, perhaps informal networks, right? Partnerships that have developed within a community to enhance, right? Right? And so again, a slight reframe, but goes far when we think about community engagement, making sure that, the work that we're doing is mutually beneficial, right? And so we're benefiting, right? And are we outlining how the community itself can benefit, right? Whether that's access to information, right? Whether that's access to the results of a program or a study, right? But how are we making sure that there's a consistent feedback loop, right? And folks are included in it, right? And so what does that look like? Well, in what ways have we benefited from partnering with the community? And that's a question for you all, right? In what ways has the community benefited from partnering with us? Have they benefited from partnering with us? You see, sometimes, as providers, we represent organizations and we have this huge, new program is bright and shiny, and we say, well, where's the community? They don't come out, right? However, we fail to take into account, the, years of harm, right, that we've done as an institution, right, that community don't forget about, right? But we want them to jump on board now, right? Where you at, right? But are we willing to, unpack our own organizational baggage to be able to orient ourselves around the best way to engage? And so, is it mutually beneficial? And lastly, just to unpack, resource and compensate it, right? So Rebecca mentioned this, right? Pay people, right? Like it sounds simple, but it means a lot, right? You're just as important as the person next to you in this conversation. Your value, your perspective, your insights are just as valuable. And we have, a number of different writing pieces and tools that we can share to help, incorporate fair compensation practices within your organization. And so again, we have, kind of a tool that goes more into detail about those 9 characteristics, but just wanted to give you a brief glimpse as to what those practices look like. And so the best time to plant a tree was 20 years ago. The second best time is now, right? And so, yeah, you can think about what's happened, but start today. Start today. And really thinking about how does this work unfold. And then lastly, a couple, plugs. We run a national conference every year. We were having I think our 9th conference in Pittsburgh, Pennsylvania, in October. And so expecting, over 700 folks, healthcare providers, foundations, grassroots organizations, CBOs, really everyone and anyone who are invested in helping to support communities. And so it's just really a conference that I find, re-energizing. And I always leave it just feeling committed to their work and just with just a roadmap of new ideas and that we can incorporate in our organization. And so you're encouraged if you're interested. And then lastly, we provide a lot of training and consulting. And so feel free to go to our website. We do free webinars and different things. If you would like more information, you can always go to courses.camdenhealth.org. And so again, we are community focused, right? Community member focused, individual lived experience, and in addition, we focus on our healthcare community, right? How do we better inform our practice and do our work differently in order to meet the needs of people? And so I think ending there with a big thank you. And I see, yep, go ahead. Unmute it.
Yeah, I just wanted to
Someone-
thank you, Victor and Rebecca. This was excellent. I want to encourage folks who are listening to please send in any questions that you may have. So many questions. I think it's fair to say, you mentioned something around the resources, the tools, the approaches that we can kind of think of. And to kind of recap, it sounds like the way to get folks to really be in community with institutions and clinics and health centers is you need to pay them. You need to maybe offer them a little bit of training so that when they're at these tables, they don't feel so othered, which can happen very easily. You need to share feedback so that the experience is mutually beneficial. And you need to kind of foster those relationships so that those relationships are lasting. I'm curious about what you would say to someone who says, well, I'm willing and ready to do all of that, but I am in an institution that's been around for 100 years, and there's been so much historic hurt between this community that we want to engage with, and the institution. And so me, I'm like a new resident, I'm a new doctor just coming in. How do I engage in this space, knowing some of that history that's existed? And so I'm just curious what you would say for someone who's wanting to do this work and knowing that they have unearned but real, maybe medical mistrust that exists since they're a member of an institution that may have done harm in the past.
Good pick up. Okay, I'll take it right back. So yeah, so I think a part of it is just first acknowledging that, right? I think sometimes, we expect for people to jump on board at Terminal C and ignore what happened at Terminal A and B, right? But again, want everyone to kind of jump on board. When we think about, the context of health and hospitals in this country, really its roots are messy, right? Desegregation didn't happen in this country when we think about our hospital systems until the late 60s, early 70s, right? And that didn't come about as a result of goodwill, right? That didn't come about as a result of people saying, hey, right, we want justice, we want equity, right? We want fair. Now, the reason it came about was because of Medicare, right? Medicare was the main driver in payment, right? And so, again, when you think about the history of hospital health in this country, its roots are messy. And I think it's important to acknowledge, right, what the historical implications of what that's meant, right, for communities. Not that we have to stay stuck there, right? Not that we have to stay in the mire there, but acknowledge it, right? And then work with community to understand, okay, how do we want to address this? Do you want to address this, right? We're talking about partnership, but maybe the community doesn't want to talk about partnership at this point, right? But also being open and transparent and willing to have that dialogue. I'll also say, what our experience has been sometimes, in communities, there's one or two persons who have a large influence, right? However, sometimes those one or two voices reflect, right, the opinions, thoughts of the community. And other times, those one or two voices don't necessarily reflect the overall thoughts, perspectives of the community. And so I say that to say there's also a need just to diversify data points, right? When we think about community, right? Sometimes we might rely on one or two people that we know, right, to give us a perspective. However, it might not be a robust or complete picture as to what's going on to help better drive a decision or improve strategy. And so, in simple, I'll say, start. We've already done the damage, right? Start. It's not complicated. Start with a conversation. Be transparent and be open.
I'll add to that, Victor, too, in doing work in this space. One of the things that I find that's interesting is it requires a huge degree of humility because, I had one experience where in conversation, people just wanted an apology for things that had happened before. And it wasn't even something that I had done, something that I was really a part of, but as a representative, if you will, of the institution, it meant something to them to have me say, I'm sorry that this happened. And so I think it's important, as you've said, to ask the questions of where are people, start at Terminal A, where are people now, and to address wherever they may be, including if they just need something like a simple apology. Rebecca, I want to put this question to you from Dr. Swiderski, which is, could you speak in more detail about how best to recruit community members so that they truly provide an accurate representation of those that might be sought to be included? So I think that this question is getting to, let's say you're working on a research area or working on a project area related to a certain disease state. How do you find the right people to kind of be able to sit in these seats? And maybe, Rebecca, we start with you and then we go to Victor.
Yep, sure.
It's just starting from the grassroots level, and that's something that's brought me in. And once you start to get buy-in from a couple of people, then you get the trust of one or two, and then they open up their network and then start bringing the people that trust them, and then that's how you really build, and it snowballs from there. But I am 47% Native American. So there's a lot, you talk about distrust, there's a lot to be remedied in that area as well. Although I don't live, I don't even know which tribes I belong to, but I know for sure that my ancestors were here in the South Texas area, and you know, they were obviously here, and they we have people here that are still around, and you have to build from them, and then it just branches out. And that's, I've seen that happen here in the South Texas area. So there's a lot to be said about, you start small, and then once the people that you first go after, once they share it within their network, it just builds trust from there.
Excellent, thank you. Victor, would you add anything?
Yeah, I would just add, so like, I think sometimes we think about like recruitment of community members is like, well, where are they at, right? I think there's a parallel with it and like our institutional organizational hiring practices, right? And so when we're making a hire, what are some of the things that we think about? We think about where we're posting, right? We think about compensation. We think about what are the supports needed, right? We think about what is the training needed. We think about this person's scope of work, right? We think about what is the appropriate background, right? And so all of those things are hugely important and relevant when we think about the recruitment of community members, right, for a project or initiative, right? To be very thoughtful about, well, what it is or who it is that we want, right? What are we asking them to do, right? What is the background, right? What is their scope? What are we going to do with this information? How are we compensating folks, right? And so I think that there's parallels between a recruitment of community members, right, to projects, as we think about, you know, even our hiring practices as an organization and institutions that can be implemented to improve connectivity.
Excellent, thank you. And Rebecca, you mentioned this a little bit in your comments, but you talked about going to the Hill to advocate. And I'd just be curious to hear from both of you of what the role of civic engagement, political engagement is as it relates to the work of community engagement to improve health outcomes. How do these overlap, and how do you see them kind of being in conversation with each other?
I'll go ahead and speak to that first. It's all money based, unfortunately, and we have to, especially with the research, with cancer research in particular. Cancer research saved my life. When I was diagnosed with my ovarian cancer in 2001, I had a very rare type of ovarian cancer called germ cell, which is akin to testicular cancer in men. And this was in 2001. And my doctor told me 10 years before that, they didn't have a good chemo regimen for my type of ovarian. And there would have been very little that they could have done for me. Like, that would have been it. But thanks to research, we found out that the same chemo that men got for testicular worked on this specific type of ovarian. And that was all due to research. So most of us aren't able to do what we want to do in these communities without funding. And it's all about going to the Hill and letting our legislators know, our elected representatives know what the money is doing back home and how we're saving lives and changing lives. And the ones that make the trips up there to let them know and beat the drums are the ones that stand out a little bit more. When we share our stories as survivors and advocates, our stories stand out as opposed to somebody that doesn't make the effort to go up there and meet with them in person.
Vic, I think you're muted. Thank you, Rebecca, for that.
No, I was just saying, a colleague of mine has a quote that she oftentimes says, you know, the smallest prism shines the largest light, right? And so really, how do we think about each person's unique individual story, right? And use that as an opportunity to shine a light, right, on public health issues, right, systemic issues, and the transformation that needs to happen there. And so I think there's a lot of overlap when we think about community engagement, civic engagement. You know, how do you organize, right, people? How do you use storytelling practices, right, to help drive change? How do you think about, you know, micro engagement, macro engagement, in the intersect, right? And where does it intersect, and being strategic and thoughtful about that. And so there's just so much overlap in the work, and it's important, right? As you know, you go from an individual communicating or advocating around my personal needs to now how do I shift to organizing or communicating, advocating around a community need, right? And that's a different, slightly different skill set, might be a slightly different perspective, right? And so is really being able to work with individuals to help grow and transition in that way.
It's really well said. And I think what you mentioned about the storytelling aspect, especially as it relates to civic engagement, 2 points that I think are worth reminding ourselves of is, this work is civic engagement work as it relates to improving health outcomes is by just its nature nonpartisan. And I think it's always important to remind people of that because people get so nervous thinking about like politics and healthcare. Asking for more funds for, let's say, cancer research is nonpartisan. It is just directing funds that would be used for other things to health. And then the second thing too is I really like what you said about storytelling and its power. And I think as we think about those with lived experience, we can remind ourselves that many of us who are listening are residents, staff, attendings, we're engaged in healthcare. And the power of having witnessed what many of us have witnessed and provided care, there's, I think, knowledge in there as well. And so in addition to kind of working with our patients to provide their lived experience, like we all also have lived experience and can think about the forums that we're sharing it in, so, that might look like, Rebecca, your clinicians coming with you to the Hill to share the importance of this funding to be able to really drive and move things forward. We are coming to time, so I want to ask just a final question, which is around how an institution, a big institution like Montefiore, multiple hospitals, one of the biggest institutions in New York, how they can do some of the work that Camden Coalition has done as a health institution. Should folks who are listening be thinking about this more as, this work can be done at our clinic with having a community, with having kind of a patient community advisory board? Or are there efforts that the kind of larger health system can undertake? Give me one moment.
I would say we're only limited by our own minds and what you think your abilities are and your own challenges are and your own sphere of influence. But I think you could mold just about anything to whatever comes into your mind as how you can make things better. I'll toss it back to you, Victor.
Yeah, and I think coupled with, being open to hearing the community. And so I say that to say, going into that conversation with the spirit of I might hear something that might not necessarily have been in our cards, right? Or what we might have been thinking about, but something that the community is advocating for, something that the community feels like is a need or a priority, right? And so I think, huge institutions thinking about where we are allocating our resources, right? Our investments, right? When the budgets, right? You look at the bottom line, right? Where are things being allocated from that perspective? I think is just vitally important. And don't become paralyzed either, right? And I think that's what we've also seen a lot in our work. Particularly when we talk about CE, diversity, equity, inclusion, right? People want to get it right, right? And it's like this overemphasis on getting it right before you move to the next step. And like it's not going to be perfect. Just create the proper environment with the proper boundaries, limitations, and with the right conversation to get started. And so that would be my admonition to big institutions who are trying to move this work along in communities who have been impacted negatively and poorly over the years.
And I think it's also great because, your last slide was all the resources and coaching and trainings and consulting services that Camden Coalition offers. And so there's a real kind of like, you don't have to reinvent this roadmap. We have the tools and resources, like, let us help you and teach you. And so I hope folks that are listening kind of have that sense of like, we can do it because it's being done. And we have certain folks who can help us guide us through this pathway as well.
Yeah, and I'll just add quickly, and that doesn't mean we're perfect either, right? That's after a lot of mistakes, after a lot of learning. I got cursed out by a CAC member a couple of weeks ago, right? So it comes.
You're not doing the work right if you're not being cursed out.
Exactly. Like if you're not in it, like you're not in it. So just commit to it. And yes, we can support, right? We can help to guide and share learnings and all of that good stuff. But just start.
Excellent. I want to open it up to any final questions from our audience members, either in the chat or you can just unmute and ask them before we wrap up.
I wanted to ask about your funding. We're doing a project here that is trying to, we've always had community advisory boards at our health centers because they're federally qualified health centers. And so that's a requirement. But it doesn't seem that, first of all, I think people are maybe get a meal or a Metro card, but they're not really reimbursed for their time. And I think it's very variable who ends up being on those committees and maybe who, who is approached to be on those patient advisory committees. So we do have a project that we're trying to reach out to people in the community using community ambassadors. And we have some initial funding, but I'm afraid that, and we got some of that was from our own institution, some seed money, and then we did get a grant. But I'm curious how you keep it up, because a lot of our time is spent on trying to write more grants, and and you know how difficult that can be.
So, our funding organizationally is a very, I guess I would call like a braided model, right? And so we receive funding from a number of different, avenues, resources. What I'll say, one of the things that we've done, I guess effectively, specific to our community engagement and CAC and those type of bodies, is to not think about those as like separate groups or programs that need to be funded, but to think about how do those programs funnel into other initiatives that the organization is already running or promoting or trying to find dollars for, right? And so, for instance, just to give you a clear example, right now in New Jersey, there's a push to get all kids covered by insurance, right? And so that work is happening, policy, right? And so there's funding for that, right? But now, how do we think about bringing our ambassadors, right, our community members into that work, right, in order to continue to fund it, right? Similarly for Medicaid redetermination, right? That was a big push, right? How do we think about connecting right? We have a behavioral health model regionally, statewide that we're implementing. How do we think about our ambassadors? So we tend not to think of our ambassadors as its, own programming, but really think about how is it a complement to our organization, in its entirety, and specific pieces of work and initiatives that are unfolding that we can provide additional levy dollars to support. And so I think that that's been effective. Even labeling, as a research group, right? You got to get, very fancy when it's a research, right? We're talking to folks, right? All right, it's research. So just, really thinking about how do we braid that group into our standard programming and other initiatives.
That's very helpful. Thank you.
So at first, I just want to say thank you for this presentation and really talking about all of your fantastic work. So much of it just resonates with me, resonates with the work that we're doing. As Ellen just mentioned, I'm part of the group that's doing that project, to really engage community and really, focus in on storytelling, focus in on listening, and then bringing back some information and hopefully getting that into decision-making spaces. So this has been really helpful. And I guess one of the things that you all talked about was the importance of, institutions also being able to acknowledge some of the harms, being able to kind of, be open to that. How have you all been able to, get institutions to really think about that piece? How's that been for you?
You want me to go? Yeah. So I think for us is, sharing our own, I guess, lived experience, right? As an organization and just, some of the, highs, right? Challenges that we've seen in our work. I think when I think about, 10 years ago, where our community engagement work was at compared to where it stands today, even our representation in the community among, individuals, among partners, or I think, it looks different, right? And that's, largely to the extent that we've been able to say, hey, as an organization, these are the things that, have worked well. These are the things that we feel like we've missed on, right? And so I think for us, just being transparent about our own personal experience, sometimes, encourages softly, right, individuals to be willing to take that risk, if you want to call it a risk, right? But to really be vulnerable in that way. And it is, some are willing, others are not, right? And right, it has an impact on the work that we all do. And so, I also think about CE oftentimes as like in health system, health world, right? Quality improvement. You have, Six Lean Sigma, right? All of these different, right? How do you improve the quality, right? Well, you're missing out on like an entire like group that can help to improve services program, right? So like, how do you tap into that? So even if you have to like orient people to think about like groups differently, right? Like that's a part of the work as well. And so again, like institution to institution, I think it varies, right? Based on folks' willingness. But as we shared, there is much more of an appetite. We've seen in even the last, 3 to 4 years to have these conversations as opposed to, 10, 15 years ago.
Well,
Thank you.
on that note, thank you, Dr. Davis. On that note, we are going to go ahead and wrap. I want to thank you so much, Victor and Rebecca. And just want to say that, again, the kind of utility of this work is that you have done it, you are doing it, and you are providing, I think, assistance to help us think about and do it as well. Did anyone have any final questions? I just want to make sure I don't miss anyone. No. We are always kind of making sure that we remain in community by asking if there's anything that we can do to help support your work. And so in our follow-up email, I'll send out the link to the conference and anything else that you'd like for us to kind of be able to help with or contribute to. But to wrap up, I'm going to go back to my slides very quickly and just remind folks for our next set of rounds, which will be at the end of April, as Jessica has mentioned, we would love your feedback for this session. So please feel free to check in the chat and fill out the feedback survey before you drop. And as always, we are open to any topics that you'd like to see us cover. So feel free to reach out if there's anything that's really burning that you'd like for us to kind of, make space to discuss in these rounds. And on that note, Victor, Rebecca, thank you again so much. Camden Coalition, thank you so much for joining us. Please thank your colleagues on our behalf. Take care, everyone.
Thank you.